In 2019, I was in charge of a working group of the FEAM, and I had the privilege to work with Geriatric. The report was called Transforming the Future of Aging, and within the report, we spoke of infectious disease, but we did not have time to speak about vaccines. So, discussing with the president of the FEAM, Geriatric, I told him, why not having another report concerning vaccination in adults. And at that time, he was convinced that the topic was very important, and he decided to create a small group working on this very, very important topic. And for this, he asked a lot of very well-known experts, immunologists, vaccinologists, specialists in public health, specialist in infectious disease, and he asked me to be part of the group as the only geriatrician. So personally, I am extremely convinced that vaccines has a very important role when we are speaking about healthy aging. And I am sure that we need to increase the vaccine health education of all the population, but especially to increase the education and vaccine education of the healthcare professional. And for this, I was voluntarily participate in this working group to try to have the most simple, the most convincing, the most understandable messages to convince people to increase their knowledge in vaccines. And my personal role was to give an overview of the problem that all people have with vaccines, and vaccine with all people, and also to build with Professor George Griffin the recommendation at the end of the report. When people speak about vaccine, they always think about children vaccination. And children vaccination was promoted for decades and decades. And they showed that this children vaccination was very active and very protective. And in fact, this vaccination starts to be more and more mandatory. And now, for example, in France, children cannot go to school without 11 vaccinations. But for the young adult, it is more complicated. Firstly, because adult vaccination was completely forbidden of the medical use and healthcare professional use. But we had the privilege that now, as ages are increasing, and years are increasing, we need to think about all people vaccination. What is surprising is that in one way you have children vaccination which are mandatory, and we have old age vaccination which are recommended. But between the two vaccination schedules, there is nothing. There is a lack of vaccination for adults. And now, when we are speaking about adult vaccination, we are thinking about two types of persons. Firstly, people with different kinds of diseases, asthma, COPD, diabetes, etc. And this person could be 60 or less than 60 with this kind of disease. And the second target population is the old population over the 65, 70, 75. And what is very surprising is that for the people with disease, the rate of the coverage rate, vaccine coverage rate is very low or quite low, less than the old age vaccination, which is not high. So we have this kind of imbalance between no vaccination at midlife, vaccination of adults with diseases, vaccination of all adults. But whatever, there is a lack of vaccination. And in fact, I think that it is very crucial to promote adult vaccination because as we could see with the COVID pandemic, there were a lot of problems with adults and infectious disease. And as we will see later, we need really to understand that vaccine is probably one of the most useful public health measures, that this measure can protect every individual, but also can protect all his surrounding, and it is really something which appeared clearly with the COVID pandemics. We have to protect ourselves and we have to protect our surroundings and loved ones. But I think that something which is still missing is that we don't know, or we start to know, which are the role of the non-infectious role of vaccine. And now in the report, it was very clearly shown that vaccine protect against a lot of diseases, and particularly vascular diseases. Vaccine protect all adults against coronary acute disease, against mortality from heart failure, mortality from renal kidney disease, and also probably are very important to protect against old age dementia. So this kind of notion of the non-infectious aspect of vaccine are not known and need to be more promoted. And more than that, I think that until a few years, we did not know that vaccines were also one good tool to protect against antimicrobial resistance. And it is now quite proven that vaccine which protect ourselves, which protect our human surrounding, also protect against antimicrobial resistance, e.g. against our environment, which is very important. And I'm sure that we need more and more to promote adult vaccination. When we are speaking about health professionals, we have to think of medical doctors, but also nurses, physio, social workers, veterinary, dentists, pharmacists, and all these healthcare professionals don't have the same education concerning vaccines. And in the different faculties or teaching school, vaccines is very often taught with only one disease or with another disease, very often for children, but not at all for old age. And also all the healthcare professionals that I mentioned before were not taught for knowing the importance of vaccine. And there is something which is a major issue, is that vaccine need to be part of the program of these different schools of healthcare professionals. And the second point is that there is currently, and it will be in the near future decade, a lack of healthcare professionals. There is a big problem of recruitment. And if I give you only one number, before the COVID pandemic, WHO estimate that the lack of healthcare professionals before 2030 in Europe will be 4 million. And you can understand that with the COVID pandemic, this number will increase drastically. The main problem that the healthcare professionals have, they don't really perceive their role, not only towards the patient, but always also toward the community. And I would like to tell you one story which shocked me as geriatrician. A few years ago was published a nice French paper which targets nursing home residents and healthcare professionals working in nursing homes. And they compared the rate of vaccination of the healthcare professional, knowing that the rate of the old adult residents were quite the same. And what was shown is that the mortality increase in people in the nursing home where healthcare professionals did not get the vaccine, the flu vaccine. And you can imagine how it is dangerous to know that if you have a nursing home, the danger is coming from the nurse and from the other healthcare professionals which are not protected against vaccines. And vaccine of the healthcare profession was never said that being a criteria to choose a nursing home or another nursing home. So I think that the responsibility of healthcare professionals are not enough push front. And I think that for me, healthcare professionals need to have a mandatory vaccination. Mandatory vaccination for all the healthcare professionals to assume their responsibility to the patient and also to the community. Until now, in Europe, the different European countries did not agree to have the same and unified adult vaccine calendar. It is a big problem for me, but the problem is not really to have or not to have a calendar. The problem when we are comparing the different vaccine schedule for adults in different European countries, they are quite the same. Very few differences, not concerning the vaccine types, but concerning two very important points. The age to which we have to give the vaccine, 50, 55, 60, 65, very small difference. But also concerning the reimbursement and the prices of the vaccine. And the problem is not on the calendar itself, but on the agreement concerning the different ages in the different countries and concerning the different prices and reimbursement procedures. It is one of the main problems. The second problem, which is after the calendar, is in fact the problem of the care delivery. The care delivery is also very different from one country to the other country. In a few countries, only GPs are able to give the vaccine. In other countries, pharmacists have a more important role. And you saw that during the COVID pandemic, a lot of other healthcare professionals were authorized to give the vaccine. And there is, in this kind of care delivery, the system is different. Sometimes the old adult has to go to the GP and then go with to the pharmacist and then go back to the GPs. So it's very complicated. So we need not only to speak about the calendar, but you need also to speak about the way of delivering the vaccine. And indeed, what is fourth point, which is very important, is we need to have a consensus of the policy makers. The health policy makers have to say, yes, we will try to find an agreement concerning this kind of different activities, which is quite difficult to imagine. So as medical doctors, we can say that we need the vaccine at the different age we need the vaccine, but the organization and the wish to get all the population vaccinated is from the policymakers. And very often the policymakers did not realize or do not realize that vaccines is not only a very nice public health measure, but also it decrease the cost of care. And the benefit linked to vaccine concerning the cost of care are very, very important. So we need, as scientists, not only to speak to the different organizations in charge of the schedule of the vaccines in adults, but we need also to speak to all the different stratas of the population, to speak about with the policymakers, to convince them that if they invest in vaccine, they will earn money. If we need to have clear message for them, we have to have clear message for the healthcare professional, and we have to have clear message for the population. And as I said at the beginning, one of the main problems is that the vaccine literacy is too low for all of them, and we need to do a lot of effort. And I hope that the report, the FEAM report on adult vaccination would help to understand really the good action of vaccine in the whole population.